therapeutic exercise relieves pain. And we know that, we've known that for a long time now in osteoarthritis. But we also know now that it does not harm knee joint articular cartilage, nor trigger inflammation. So that is to say that clinicians and healthcare professionals treating people with knee osteoarthritis can reassure them that exercise does not harm their knee joints.
Yeah, I think that's a really important message to get out there. How do you think that we can convince people, the patients out there, that exercise is good for them, good for their knees? How do we overcome some of maybe the misinformation that people may have received previously?
That's a very good question. And what we definitely know is for sure that by telling them that they should exercise, it's not enough. Maybe what I think we should do more often and more systematically is to encourage, but educate particularly them, and plan together with them, with the patients, what exercises to do, when and how. I think it's also important to provide patients with practical support. And that could be, for example, a membership to a clinic where there are qualified kinesiologists, physios, or exercise physiologists that can actually support them practically. And sometimes it also seems that by giving the patients tools to self-monitor their activities, it's actually helpful to motivate them to engage in exercise.
So where are you working right now? Are you working for an institution, university, or what are you doing?
Yep, I'm working as a postdoc at the University of Southern Denmark. And I have this joint position between the university and the hospital here in Denmark. And on a project where we we are developing and testing an exercise and self-management intervention for people living with multimorbidity. So they have many chronic conditions. And yeah, that's the primary, the project I'm working the most, and the project I've been hired for.
Yeah. Could you talk a little bit about the intervention involved in, like, what kind of exercises and how that's being implemented?
So it is an exercise therapy intervention plus self-management, meaning that these patients will attend group clinics, group-based exercise sessions supervised by a physio, and plus self-management sessions where they will learn, they will be given the tools to help self-manage their conditions. And the exercise components are aerobic and strength training exercises, and a mix of both. And we will give the patients the possibility to choose the exercises that they prefer to some extent.
Oh, wow. So do you feel like that gives the patients a feeling of control about what they're doing?
Well, we hope so. And particularly because in general, with exercise, we know that there isn't much difference in the type of exercise you do with regards to health benefits. The most important thing is that you actually do it. And we know that patient preferences might play a role in motivating them to exercise and actually do it. So we'll see whether this approach is actually good for them we have developed the intervention together with patients, but now we are testing the feasibility of it. So soon we will know whether they accept it and they find it feasible.
Yeah, of course. So that's like a really important piece that I think sometimes is missing from the research that we do, which is like engaging the patient as a stakeholder within the project. How did you go about like making sure that they were involved in sort of like the making of this intervention?
Yeah, that's not easy. That's a good question. And we have two patient partners which attend our meetings and are part of the decision-making process. Our goal is that, I mean, what they say is as important as anybody else. So they have the same weight as the clinician or the physios and the researchers. And we try to incorporate what they say in practice. It's not easy, but the method we use, it's basically just to involve them in all the processes of the research and ask if that was something that they liked or not, if they had feedback on it, and whether they would do it or not.
That's really cool. And how did you get involved in this line of research? Because it sounds like you were saying you're working with people with multi-morbidities now. But based on what I know about you, you've definitely done some more research in knee osteoarthritis populations as well. And so I know that there's a potential overlap there, but yeah.
Yeah, true. So we know that people with we know that exercise is medicine for people living with osteoarthritis, but we actually don't know whether exercise is medicine for people living with osteoarthritis and other conditions. So we are doing this project to collect evidence and see whether exercise could be actually medicine for people living with multiple chronic conditions. And as you know, many people with osteoarthritis live with other conditions, such as diabetes, hypertension, or depression. So we are trying to see whether in this population, exercise could be a useful tool to improve their quality of life.
Yeah, I love that message of exercise is medicine. It definitely is something that speaks to me and like my own research, but I really think that that's a great message that needs to get out to patients and the healthcare providers that are treating them. What's like a typical day like for you as a researcher? And maybe this is a little changed because of COVID right now, but what has been your experience?
So yeah, as you know, with COVID, a lot of things have changed. What I've been doing basically, it's as a postdoc, the majority of my time is spent on talking to colleagues and patients and healthcare professionals to get feedback on the intervention we are developing as of now. Of course, during this pandemic, this is all done online, but I usually start early in the morning and finish mid-afternoon, and then I have some time for my hobbies and family.
Well, that's great. And exercise, probably, right?
And exercise, yeah, this is one of my hobbies. And you know, we always recommend people to exercise, but we have a very sedentary job. So it's actually, we need, in addition to promoting exercise, we also need to exercise ourselves.
Yeah.
And you can understand that sometimes it's hard because we're a very sedentary jobs, but it's something that we should do, and it's something I like to do.
Yeah, absolutely. I am excited that I've been getting back into the lab side of things, because I definitely move a lot more when I'm collecting data, which is nice, but yeah, it can be really challenging, which might give us a good perspective as, what people who work in offices and sit a lot more in their job, like some of the challenges or barriers that they might face to incorporating exercise into their daily lives. So did you have a daughter or a son?
It's a son, Federico. Yeah.
Oh, that's wonderful. How's that
That's a
going?
little boy.
How old is he?
It's going well. He was born the 6th of March. And it's been a bit of a roller coaster the first 2 weeks, but now it's getting much better, and we're sleeping much more now.
Yeah, I was gonna say, I'm impressed that you're sleeping as much right now.
During the night, he sleeps quite a lot. Of course, he wakes up 3-4 times. But it's sometimes the hardest part is during the day, where he really has troubles in falling asleep. But that's how it is.
How is your wife doing?
She's doing well. She's doing very well. She recovered very soon. Actually, the day after she gave birth, she was up and doing almost everything.
Oh, that's really great.
Yeah.
Is this your first child?
Yes.
That's so exciting.
Yeah.
Are both of your families like really, really happy, excited?
Yeah, very much. We have my mother, who is here in Denmark now, and she's helping us quite a lot.
That is so nice to have. Oh my gosh, that's so nice.
Yeah.
Well, Alessio, thank you for joining us. I think you provided a lot of great insight as to how exercise is medicine. And we look forward to seeing you at the Forum Series in July.
Thank you very much, Caroline. It's been a pleasure. And I would also like to take this opportunity to thank my former supervisor, Professor Eva Ross, which helped me to survive during my PhD project.